So let's talk about what makes up the cervical spine. I think we have, let's do a little medical anatomy. I love this, you know, a little education 101 on the spine. So are we using a graphic, gentlemen, or are we using the prop here? Denise? Let's do the prop then. Okay, fantastic. Thank you. That's my producer who's always on call for me. Love her. So let's use that as an example and tell us exactly what we're looking at.
So essentially what you're looking here is actually like myself looking at you from the front. Yeah, that's myself. Yeah. Hi.
That's funny.
Yes. So this is the base of the neck here. So you have the different bones or vertebras, okay? In between the vertebra, we have this, the cushions, or what we call the disc, which basically they are mostly the shock absorber of the spine. And between the bones and the disc, towards the back of it, you can see that there's a hole here, and there's a yellow structure coming out. Those are your nerves. And in front of the nerve, we have a very important structure. It's called the vertebral artery, which actually sends the blood from the brain, from the heart to the brain. So those are the key elements here on the cervical spine that we have to be conscious about. We have the bones, the disc, and mainly the nerve. And in the back, we have a pair of joints we call the facet joints.
Oh, keep going. I'm just going to hold it steady.
Oh, okay, perfect.
Just hold it steady right there. Yeah, perfect.
Hold my neck.
Okay, I'll do that here. No,
okay.
No, but keep going. And then obviously the cushiony stuff is very important. Doesn't that wear and tear over time, this part over here? This little...
Those are the ones that they start wearing off as we start aging. Those are the disc. And basically once they start aging, the whole thing will start coming after. So normally the disc, they bear about 80% of the load of the spine. So if you have, if the disc starts degenerating as we start aging, more pressure will be referred to those joints, and that's when the arthritis of the neck will start coming. So just imagine that 80% of the load is being coming out from this joint, and the other 20 will be 10 and 10 from this joints here. So if this is now, let's say 60%, so where the other 40%, it will rely on those joints. Those joints will become arthritic because they hypertrophy. They need to sustain the load, and that's when we start developing what we call arthritis of the neck.
All right.